Good morning, good afternoon, good evening, everyone, and welcome to today's webinar on strengthening nutrition for growth commitments for large-scale food fortification in Asia. My name is Saskia Ozendorp, and I'm the Executive Director of the Micronutrient Forum, and I'm very honored to be here with you this morning for today's discussion. This webinar is co-hosted by the Micronutrient Forum in close collaboration with the Food Fortification Initiative, the Global Alliance for Improved Nutrition, or GAIN, Helen Keller International, the Iodine Global Network, Nutrition International, TechnoServe, UNICEF, and the World Food Programme. And I would like to extend a special thank you for our partners and our co-hosts for their support in making this webinar possible. So why are we here? Well, a month from now, at the end of March 2025, the Nutrition for Growth Summit will take place in Paris. And at this summit, governments, donors, businesses, and civil society will come together to make commitments to tackle malnutrition. And in this discussion today, we will focus on large-scale food fortification, which is one of the tools that governments have in their toolbox to improve micronutrient intakes of their populations in a sustainable way. It's a proven, cost-effective solution for reducing micronutrient deficiencies, and it can even be considered one of the solutions for the transformation of sustainable healthy food systems. Asia has made significant progress in large-scale food fortification, but challenges do remain in realizing its full potential, and that will be the focus of today's discussion. We will hear about experiences in Asia, and the aim of this webinar is to catalyze action and accountability to mobilize smart commitments in large-scale food fortification, tackling areas where that are currently blocking progress. Before we begin, a few housekeeping notes and reminders. First of all, your microphone and your cameras are off during the webinar. You can use the chat function to introduce yourself and share more general comments. And if you have a question to one of the speakers, please use the Q&A function to ask these questions and also identify and indicate to which speaker your question is being addressed to. We will do an effort to address your questions during the webinar, and there is a short Q&A session at the end of the webinar. We have live translation available through an AI app called Wordly. We will post instructions how to use this app in the chat, and it's available in 60 languages. The webinar is being recorded, and the live stream will be available very soon on the Micronutrient Forum's YouTube channel, so we encourage you to follow that. Now, without further ado, I'm very, very pleased and honored to introduce our first speaker, the keynote speaker, Dr. Luz Maria del Reguil, the Director of Nutrition and Food Safety at the World Health Organization. Luz, over to you.
Thank you so much, Saskia, and thank you to the Micronutrient Forum and other co-conveners for the invitation. It is a pleasure to be in this panel, and for many reasons. One is because of the conveners. The second is because the topic is relevant and timely, and we have experience to build on. So fortification, as you know, it's an intervention that is core to the food systems transformation. When we think about our food systems and whether the food is delivering the right amount of nutrients to the people that need it the most, we certainly we know the answer. The answer is no, it's not. There are many places that many people, millions of people, 2.8 billion people that cannot consume a healthy diet. For multiple reasons, for supply chain issues, for equity issues, for multiple reasons. So we have a challenge. We have to ensure that the most vulnerable receive the best nutrients that they can. And fortification is one of the solutions. We need to transform the entire ecosystem, but one of the solutions that is part of that toolbox, as Saskia was mentioning, is fortification. And why fortification is a high impact intervention. And in comparison to many others, even a low-cost intervention. It's not cheap, but it's a low-cost intervention. So it's a highly cost-effective intervention. And why is that? Because it has the political arguments, it has the evidence arguments, it has the technical arguments, and it has the equity arguments, and it has the right entry points in different countries. We know that it's not the only solution, but it's part of these multiple solutions that we can bring together. Just let me elaborate a little bit on the evidence base. We know that fortification is effective. It has been implemented by countries since the last century, with, in many cases, with high success, like salt iodization. But we know that it needs to be sustained to actually meet its purpose. So it's not only about reaching coverage, but about ensuring that those evidence-based interventions continue meeting the needs of the different populations. Some estimates say that for every dollar that is invested in fortification, countries may get up to $27 in economic return, because micronutrients matter, because the overall nutrition matters. And we need to make sure that those that are at disadvantage reach their highest potential. And once they receive the right nutrition, they are more likely to contribute to the economy in a more productive way. We know that in the political space or in the commitment space, fortification is already part of the policy environment in multiple countries. More than 92 countries have mandatory fortification for wheat flour, fortification with iron or folic acid. 126 countries have mandatory fortification for salt. However, what we know is that not in all cases, in most of the cases, there is not enough coverage, and that's a big challenge that we are facing now. Reaching coverage and sustaining commitment. I'm happy to say that as part of the UN Food System Summit pathways and transformation pathways, fortification was one of the interventions that was mentioned very frequently. Around 20-30% of the countries included fortification as a priority action. So we need to ensure that in those pathways where the Secretary General of the United Nations work with different partners and United Nations and countries to say, what are your priorities to make sure that our food system is better, is transformed? Fortification is one of the key interventions. So we have a couple of entry points to make it work. WHO, as you know, has worked in fortification for many years, developing guidelines, developing implementation materials, convening partners to have the right conversations and to make sure that member states receive the best evidence, implementation guidance. And I'm happy to say that we are working on the update of what some people call the Orange Book, but the official name is Micronutrient Guidelines for Food Fortification, which is, and we are updating the part of implementation guidance. And why that part? Because we have made remarkable progress in terms of the efficacy guidelines, but there is no document that captures all the collective learning in terms of how to improve the implementation of fortification programs, how to ensure that they reach the most vulnerable. So WHO, stay tuned, WHO is producing on that. And WHO will also, along with other partners, be part of N4G, Nutrition for Growth. And that's a critical moment where we are looking for countries to commit to implement fortification, but also to partners to commit to support the implementation of the countries. It's not an isolated effort. It's not a lonely race. We need to do it together if we want to make sure that it meets its purpose in terms of transforming the food systems and meeting the needs of the populations that need it the most. And with that, Saskia, I wish you a wonderful webinar, and thank you so much again for the invitation.
Thank you so much for Luz, for these encouraging words, and for also showing us what the challenges still are, which is to reach coverage and to sustain commitments, but also the opportunities and the need for us to collaborate. So thank you very much for this important introduction words. We would like to now turn the discussion to give a perspective on national and regional actions on advancing large-scale food fortification in Asia. And in this session, we will hear from 4 distinguished speakers. The first is Dr. Shabina Rasa. She's the Country Director of Nutrition International in Pakistan. Over to you, Dr. Shabina.
Thank you. Thank you so much, Saskia and Dr. Luz Marie from WHO, who has set the stage for us very nicely. And greetings from Pakistan to all the participants who are joining today. At the outset, it has become very evident that food fortification is cost-effective, sustainable, and one of the best tools as a public health strategy if we want to improve the quality of food by adding the essential vitamins and minerals which are uh, contributing towards preventing micronutrient deficiencies, which is a major concern in many populations, and especially in Pakistan, as I'll be sharing some of the data that we have. Uh, I'd like to underpin that while we know that food fortification enhances nutrition, the best part is that it does not require changing dietary habits. So as we know that all of us as in our daily lives, when it's required to make a change in your life style, it is difficult. Even when you know the value of and the importance of something, it's difficult. So food fortification, therefore, comes around as a very useful intervention and easy to implement comparatively. Uh, I'll also come to why Pakistan needed the large food fortification program. It has a very high burden of micronutrient deficiencies. I mean, if we look at our adolescent girls who are the future mothers of the nation, more than 57% are suffering from anemia, and the children under 5 are also 30% of them are iron deficient, 50 to 60% lack vitamin A and D amongst this group, and women of reproductive age also, up to 80% are deficient in vitamin D, 30% lack vitamin A. So anemia is prevalent in this group. And we've been seeing this repeatedly in the various nutrition surveys that have been conducted in the country. Back in the 1980s, we did surveys for iodine deficiency. And as you know, it manifests in the form of goiter. And the population was like from 10 to 70% prevalence of goiter was seen across the country. And alarmingly, school children, they did a mean uh, uh, urine iodine concentration. It was as low as 18 microgram per liter, when we know that a minimum of 100 microgram per liter is required in order to have adequate iodine status. So with this kind of a situation, the country actually started bringing up large-scale food fortification, and a salt iodization program was introduced back in the 80s. But when NI came on the scene back in 2001, and household surveys was done to see what was the quality and quantity of iodine in the salt, it was found that it was as low as 17% in actual fact. I'll come to that later, but I'll just want to highlight the importance of having large-scale food fortification programs, because this was contributing to the burden of disease, to the mortalities in the country, and impaired cognitive development. And I developed a cost of inaction tool, and it showed that there was an annual loss of $17 billion in the country because of the reduced workforce productivity, the increased healthcare costs, and the cognitive impairments in children, and hence the importance of having food fortification in the country. Next, please. So Pakistan, where do we stand today? We have made substantial progress over the last two decades. Like I said, the salt iodization, which was at 17%, today stands at 80 to 90% across various districts in the country. Now, there are geographies where it is still as low as 30%, say in the tribal belt. And it is not as if it's all uniform. So there's still work to move forward and to carry on the agenda of salt iodization in the country. However, a lot has been done by strengthening the government and the 1,300 salt producers across the country. NI has been hand-holding, giving them trainings, capacity buildings, equipping labs to ensure that the iodization of salt is of quality and maintains a certain level as per standard operating procedures globally. Then we move to edible oil in the country. With vitamin A and D deficiency, oil fortification was the best intervention. Right now, we have 70% of edible oil, which is well up to the standard, adequately fortified. And this actually is 100% of the packaged oil which is available in the country. Now, when the government asked DIN to do a survey and see what the status was, the compliance was as low as 19%, although the program had been running. But in actual fact, compliance at the industry level was very low. So Nutrition International, with its interventions and hand-holding both with the industry and the private sector and the government, has today brought that edible oil fortification to a level of 90%. And this is from the formal sector. We have 156 oil mills, all of which are brought into the loop. And with the food regulatory authorities recently established in the country, and their capacity building with NI support, they have been able to bring up the compliance of the industries with better fortification levels. So that still needs to go on. However, though we have helped the country with establishing a market-led pre-mix supply system, there is still importation of all premixes in the country. So that is a challenge that I'll talk about. But at the moment, what we've done is we have equipped the millers with trainings on how to do the fortification processes, how to ensure quality assurance and quality control. And this has been done with the 156 oil millers in the formal sector. Similarly, a lot of trainings have gone with the wheat flour millers, and microfeeders have been set up with 1,000 wheat mills in order to bring up their capacities. We have also established reference labs across the provinces, both in the public sector and the private sector, giving them high-tech food testing equipments, and which includes high-performance liquid chromatographies, spectrophotometers, but with giving them the equipment, we've also done qualitative testing trainings for these lab staff. The SOPs have also been developed by the NI and endorsed by the government in order to make it standardized. We've also ensured to bring in data to fortification information system called Fortis. And along with the Fortis, we have another digital tool, which is called the iCheck Connect. And that enables us real-time compliance tracking. This is so important in order to make sure that whatever is happening in the field, the data is coming and being shared with the government and with the industry. In fact, the industry is encouraged to do self-regulation and to have a quality assurance and quality control by themselves to promote their sustainability. And because of all these interventions, at the moment, I think Pakistan is doing very well with edible oil fortification. But there is a 30% oil which is in the market, which is coming from the informal sector, and that is not safe actually, because it is not neither is it fortified, or it is brought into under the authorities are actually not paying enough attention, and the vendors are moving ahead with promoting the cheaper oil in the market. And so it is a challenge to make sure that all that also comes into under the realm of the to bring that 30% also under 40 to make it more pure, because it is the poorer segment who is right now using that cheaper oil in the country. So that still remains a challenge. With the wheat flour fortification, that has been of recent. What we did was to make an enabling environment by getting mandatory legislations in the country in the 3 provinces, whereas the Punjab province, which is the biggest province and has most wheat flour, it is still pending, and we need more political will there to get that through Punjab and at the federal level. With the position that we are right now, we are still helping 180 million people in the country, which is getting adequately iodized salt, 140 million who are consuming fortified oil, and 100 million who are right now getting fortified wheat flour. But with the wheat flour, we need to do much more in order to bring it to a level which is more better. So with the NI support, which we are getting from the Gates Foundation and the Millers for Nutrition Initiative, we're trying to explore options such as targeting the consumers' awareness through retail channels and linking producers with retail outlets, institutional buyers, and welfare organizations. Next, please.
Dr. Raza, can I please ask you to wrap up?
Yes.
Sorry to introduce you. Yes.
Yeah, sure. So the challenges I've already spoke about, the legislation takes much longer. It takes 5 to 6 years. The industry is reluctant to take things forward unless there is cost transfer. And like I said, the informal market, the 30% share is still something that it needs to be brought into the reach of the poor. Next. So the last, please, last slide. Moving forward.
Sorry.
Yeah. Next, please. The last slide. No, I mean forward. Yeah, this was the last slide. So we're coming to leveraging this opportunity of N4G Summit. So I think this is an appropriate time that we reaffirm commitments from the government to enhance their ownership and prioritize large-scale food fortification. Also, this is a time that we mobilize sustained funding and technical support to strengthen the fortification programs in the long term, and the governments put into the long-term 5-year plans fortification as an intervention of priority. We also need to make sure that large-scale food fortification is brought into social safety networks in the country where the most vulnerable population is targeted, and they should be having access to the fortified food. Bringing in public-private partnerships and strengthening that is important. And the last and most important is to position large-scale food fortification more as a business opportunity and value added rather than a compliance burden by the private sector. So with these, I'm going to hand over to Saskia. Thank you so much.
Thank you very much, Dr. Raza, for illustrating and summarizing the impressive progress made in Pakistan on large-scale food fortification, as well as some of the challenges that remain. Our next speaker is Ms. Inoshi Sharma. She's the Executive Director of the Food Safety and Standards Authority of India. Over to you, Ms. Sharma.
Thank you so much, Saskia. I just want to tell all our audience that the Food Safety Standards Authority of India is actually the apex food regulator in the country. And our role primarily is for laying down the standards for the fortified foods. Next slide, please. And, how we've really used this as a means of scaling up fortification in the country is something that I'll be discussing. Next, please. So the first thing that the FSSAI did was, in 2018, come out with a regulation which actually laid down the commodities which could be fortified and at what levels they could be fortified. And if any product was being fortified, then a plus F logo could be placed on top of the label of the product for easy identification. So salt, oil, milk, wheat flour, refined wheat flour or maida, and rice were covered in 2018. And subsequently in 2020, it was extended to cereal products, bakery, and fruit juices. And later, under the government program, milk powder, which can be reconstituted and made into milk, was also covered. Next, please. So if we look at the standards, we have for, the 5 I mentioned initially in 2018 and subsequently that were extended. And then in 2022, as part of the government's effort to provide the fortified rice in the safety net program to the people who are getting the benefit of the particular program, and there are about 800 million people in the country, it was decided that the standards for the fortified rice kernel should also be identified. So in 2022, the fortified rice kernel standards were identified, as well as the standards for the vitamins and the mineral premix, which would go into the fortified rice kernel, were also identified. Next, please. So like I mentioned, for edible oil, we have vitamin A and D, milk also vitamin A and D, and for double fortified salt, it's iron and iodine. Next, please. For rice and wheat flour, it is iron, vitamin B12, and folic acid. Next, please. For cereal products, it is iron, vitamin B12, folic acid, fruit juices, vitamin C, and bakery ways, it is iron, vitamin B12, vitamin C, and folic acid. Next, please. And as I mentioned, this is the plus F logo, which was also identified in the 2018 regulation, which can be used by the food businesses to be displayed on the front of their label for easy identification for the consumers that this particular product is fortified. Next, please. So the two-pronged strategy adopted by the FSSAI is that there should be open market availability of all the fortified commodities, as well as the availability of the fortified products in the government safety net programs. Now, the government safety net programs are led by ministries other than the FSSAI. So the ICDS program is what works at the village level for children below the age of 5 years and pregnant lactating women. A midday meal scheme comes under the Ministry of Education for children up to the class of 8th standard to receive meals in schools, and the public distribution system, which provides fortified rice to the beneficiaries. Next, please. So where does the role of the FSSAI come? So one, of course, I mentioned was the laying down of standards. The second is that once the fortified products are available in the market, regular surveillance and enforcement drives are carried out in which samples of the fortified foods are lifted to ensure that they are complying to the standards. Then a lot of training and capacity building of the food businesses as well as the government officials is carried out. A lot of FAQs for the benefit of the consumers are also put forth. Then third-party audits are carried out so that the food businesses are not regularly, inspected by the food safety officers, but these third-party audits can in between be used to check by the FBOs if they are complying or not. And of course, a lot of stakeholder engagement is continuously done so that any doubts regarding or any questions regarding how the compliance is to be ensured can be taken care of. Next, please. So I wanted to highlight here one of the biggest programs probably in the world, which is being carried out in India, which is the mandatory provision of fortified rice through the public distribution system in India. Next, please. So here I wanted to mention that the Honorable Prime Minister had in fact announced that from the 1st of April 2024, the fortified rice would be provided through the public distribution scheme and would be available till December 2028. And in this program, 30 to 50% of the RDA requirements, which has been prescribed by our scientific institutions, which is the ICMR and the NIN, keeping their consideration, we have kept the fortified rice within that level. And rice was picked up because almost 70% of the population in India is consuming rice. And rice can be fortified for all kinds of varieties. Next, please. So one of the things which we've done to ensure that the rice which is being fortified is also at a good, level of the fortificants. Premix manufacturers have been identified who are being trained about the premix that they are supplying. The fortified rice kernel manufacturers about what are the standards and how their quality should be maintained. The rice miller who is blending the fortified rice kernel with the rice miller. Then how is it to be stored by the Food Corporation of India, which actually procures the fortified rice? And then through the targeted public distribution system, the officials who are placed at the public distribution system of how the rice is to be distributed. And then, of course, there is an entire gamut of labs, like I've just mentioned here, the lab counts that we have. There are like 13 labs for the premix, 32 labs for the fortified rice kernel, and 57 labs for the fortified rice, whose proficiency testing and the integrated methodology has been ensured. And of course, on the right, I've mentioned how many premix and FRK and rice millers are available in the country. So we've also developed an online portal called the Fortrace, on which we have requested all the premix, FRK, and the rice millers to upload the COA for every batch that they manufacture. This helps in the backward integration and also ensuring quality checks. Next, please. And I've already mentioned about Fortrace with respect to the traceability. Then we've also introduced a risk-based inspection system in which the fortified rice kernel and the premix manufacturers are on a priority basis also inspected so that the quality is ensured. And the test report, as I mentioned, has to be uploaded from the labs which have been identified by FSSAI for testing purposes. Next, please. So we, of course, are also, for the purpose of this program, also always engaged in public awareness and education and strengthening the regulatory framework so that the quality is ensured. A lot of times when a program is launched, there are a lot of myths about a particular food item. So for instance, in case of fortified rice, there was a discussion that maybe it was plastic rice which was being mixed, or that it was not really beneficial. So those kinds of awareness is one. And second, of course, what is the best cooking practices and generally creating awareness among the community. Next. So these were broadly the points which I just wanted to highlight, that we've been working on. And in this particular picture, we mentioned all the items which are being fortified. So thank you so much.
Thank you so much, Dr. Sharma, for demonstrating how through legislation the LSFF agenda in India can be further advanced. Our next speaker in this webinar is Dr. Mohammed Hannour Rashid, who is the director of South Asian Association for Regional Cooperation, SAAC, the Agricultural Center in Bangladesh. Dr. Mohammed, over to you.
Thank you so much. So next slide, please. So I'd like to highlight some of the points of the basic information of this region, and then we'll proceed for the status of the large-scale food fortification, and then some challenges as way forward so far we have in our hand. Please, next slide, please. So as we already listened to the speaker from Pakistan and India, there you know the story of the half of the story or most of the story of this region. You see the among the this region, if you see the land scale, land mass is only 3.5%, but there is a population burden is 25% of the global population. And this region, people use the high consumption of the cereal-based foods with the low contents of the micronutrients, and that causes the health hazards in humans. And that the micronutrients are mainly zinc, iron, vitamin A, iodine. So these are already highlighted. Next, please. And also, you see the backward, please. If you see the scenario of the malnutrition of this region in respect to the global and the Asia, you see in the South Asian region there is a stunted is higher than the global situation, and also even the Asian situation. There is a little bit less in the overweight, but it is increasing over the time. Next, please. So the potential approaches for the micronutrient malnutrition is the dietary diversification, that is eating a variety of foods from different food groups. Food supplementation program provides additional food to people who need it in addition to their regular meals. And the food fortification, that's the practice of deliberately increasing the content of one or more micronutrients, that particularly I mentioned about the vitamin A and the other minerals in a food. Next, please. So the factors affecting the fortifications are the prevalence of micronutrient deficiencies, population, dietary compositions, and also the infrastructure. Next, please. So the key points about the fortification in South Asia is the major fortification forts are mainly the wheat flour. It is already mentioned by Pakistan and the India presentation, and mostly which is commonly fortified staples in our region. And the countries is India is actively pushing for the nationwide fortification in several states, implementing programs for fortified wheat flour, and other countries like Bangladesh and Nepal also have initiative for rice fortification. There are some challenges. These are the uneven implementation across different regions within countries, concerns about the quality control that already mentioned in some cases, and also ensuring access to fortified food in rural areas remaining the challenges. And there is some policy landscape. Some countries have the mandatory fortification laws, while others. Next one, please. So there are some examples. You already have listened to India. The Food Safety and the Standards Authority of India already promotes fortification of wheat, flour, iron, with iron, folic acid, and vitamin B complex. In Bangladesh, fortified rice is provided through social safety net programs and available in retail markets in some extent, not in widely it is used. In Nepal, initiatives to fortify rice are present, particularly through social safety net programs. However, the status varies significantly across the region, with some countries having the wider reach and strict regulations than others, often facing challenges related to the quality control and access to fortified foods. Next, please. So we already heard about the large-scale food fortification that improve the nutrition in South Asia by adding nutrients to commonly eaten foods like wheat flour and rice, etc. What is the nutrients to salt? This makes these foods more nutritious and also available the other minerals and vitamins. So it benefits like they help to improve cognitive development in children. It can also lower healthcare costs and the increase worker productivity. The challenges is the trade barriers in the fortification level and the leveling declarations. There is a report that the trade integration is insignificant in South Asia. Small to medium enterprise in Southeast Asia and even South Asia may not have the funds or the knowledge to contribute to the fortification programs. Next, please.
Dr. Rashid, can I please ask you to wrap up?
This is the, we are going to close.
Great.
Yeah, this is the last slide. So we can go forward for the improving the access to ensure the fortified foods are able to vulnerable families. Demonstrating the impact of large-scale fortification can help guide policy and program design, ensuring an enforcement of food fortification standards and legislation. Government and donors can invest in this technical support and the capacity, harnessing the capacity of the private sector to transform the food systems and tackle malnutrition. Policy development and mainstreaming regulating fortified varieties and standardization of the production technology of different crops. Thank you so much for your hearing.
Thank you very much, Dr. Rashid, for also illustrating to us some recommendations for the way forward, which is very helpful. Our final speaker in this section is Ms. Nora Hobbs, who is the Regional Nutrition Advisor Asia Pacific of the World Food Programme. Nora, over to you.
Thank you, Saskia, and greetings to all the participants. So on my end, my intervention will focus on one critical step in the journey of fortification scale-up within a country, which is the institutional demand creation. So in the region of Asia Pacific, we have some frontrunners, as we have heard from Pakistan and India. But most countries are a largest cluster of countries are in that step where there has been a lot of progress on the advocacy, evidence generation, regulatory framework, and setting the foundations of fortification. But where now the governments and their partners are looking at pushing the scale and bringing the demand up through the national programs, so integrating fortified commodities within public systems such as school feeding or social protection systems, also health interventions. And this is the critical step that we are looking at within the 4 years of the N4G in the region. So I'll emphasize 3 points related to that, which are also aligned with the priorities within the manifesto for accelerated action for large-scale food fortification. So first, between this national and commitment is key. So in relation to this opportunity of the N4G, it's really encouraging governments and their partners to consider this phase of institutional demand creation within a potential area to formulate a commitment. We have seen countries in the region like Nepal, for example, that has been formulating some very nice commitments related to that, committing to scale to 25 districts. We have other examples. Indonesia as well is looking into integrating fortification within the school meal program. So also really being able to define targets for scale, 20 million children with school meals between now and 2025, and then up to 50 million children also being reached by meals, and then the proportion of fortified commodities within that scale up. But other countries as well are in that phase of reflecting on their commitment. For example, Philippines. So that's really the first point. The second opportunity is, so we have all these good examples that we've heard, and it's for governments and their partners, as there's a reflection on formulating these commitments, to think about the full chain and support that may be required in that scale up and that creation of institutional demand, from data and analytics to delivery systems. And we heard in the examples, science. This is as well a point in the fortification journey that requires the most investments. So the investments are very significant. It requires infrastructure, capacity strengthening. So this aligns well with the N4G pledging, relates very well for the N4G pledging side. So being able to formulate that. And requires the convening of multiple stakeholders. Maybe a last opportunity to consider is the potential to bring more sectors into that large-scale demand. There can be, some countries are very much focused on one sector, but there can be as well, this can be a time to gather more sectors and trying to see if there can be opportunities to also integrate across multiple sectors, include more interventions through health, through education, social protection, food and agriculture. So yes, there can be as well an area to provide to feed into N4G commitments by expanding different sectors. And the last point is in relation to this institution demand creation, is the leveraging the regional institutions and their role and the synergies that this can support, that this can provide in support to national governments' efforts. So just mentioning as an example, I was just joining today the ASEAN +3 Emergency Rice Reserve Annual Council, where there are discussions about integrating fortified rice within these emergency rice reserves. So these are additional supports that contribute. So thank you, Saskia, and this is the end of my intervention.
Yes. Thank you so much, Nora, and thanks to all the speakers in this section for sharing your insights in large-scale food fortification progress and challenges in countries and in the region. We will now shift to the focus on the role of the private sector, which is obviously an important player when it comes to large-scale food fortification, and we will hear about their achievements and challenges. And the first speaker in this section is Dr. Riz Yousafali. Rizwan is a program director at Millers for Nutrition at TechnoServe. Rizwan, over to you.
Thank you, Saskia. I'm not doctor, but Riz is fine. Good morning, good afternoon, good evening, everyone, and thank you, Saskia and your team, for allowing us to participate in this webinar. As we pivot into this session, I'll be talking more about the role of private sector in food fortification and unlocking its potential. Next slide, please. So as we look at the N4G summit coming up and building commitments, I think we have a brilliant opportunity to leverage more commitments from the private sector. Food fortification is one of the few nutrition initiatives that can be implemented very successfully, utilizing existing market channels of how foods are consumed and utilized. It doesn't require much behavior change. And in that picture, the sector that produces these foods and engaging them, because they already reach millions of consumers daily with basic food items with people consume every day. And so making sure that we build that commitment of the private sector and engage them in this intervention. As much as it's a public health outcome, the actions need to be taken by a multiple set of partners, and a critical one of which is the private sector, can be very beneficial to the overall success of addressing micronutrient deficiencies. But we also understand the private sector does face some challenges where the incentives for sustaining or making sure food fortification happens are sometimes seen as limited. There's obviously cost, small as it may be, but there is a cost to fortification. And in many cases, the enabling environment, there is a potential to improve that, to encourage the private sector to do more by improving enforcement of regulations, making that a more level playing field, bringing about policies that would allow and encourage the industry to participate. So as we look at the N4G commitments, I think this is one area that we can all benefit more in addressing micronutrient deficiencies by creating the right conditions that would also bring the private sector to be a key player in achieving that. So next slide. One of the initiatives that is underway, it's limited currently in 4 countries in Asia, but they're fairly large countries, where Millers for Nutrition is trying to build a coalition in India, Bangladesh, Indonesia, and Pakistan, with the primary focus of centering on millers to fortify and enabling them to do that, but also crowdsourcing all our partners, whether they be in the form of other businesses that already have relationships with these millers in terms of supplying equipment or inputs to make fortification happen, to government agencies, or other development partners that are all doing work in this area, and creating that condition. And we've realized that through working with the industry, we can reach the impact is very big. There are already a number of companies, even where fortification is not mandated, or have taken huge steps in fortifying products, and they're reaching, if not billions, millions of consumers daily. And Millers for Nutrition is trying to strengthen that. We think that we can further improve and fully exploit the potential of this channel by making fortification excellence easier for millers. So the coalition is supposed to enhance and support the millers in strengthening the business case for them to fortify, and more rewarding. One of the schemes that works very well in the program is to recognize good performance, whether it's by partners or by millers, and to showcase that, because success breeds success. So that's in a nutshell what Millers for Nutrition is trying to do. The next slide. And so how does this relate to the N4G Summit? I think we believe that the N4G Summit, which is an opportunity for different groups of partners to make some strong commitments and live up to those commitments, is a very important meeting coming up. And there are some highlighted key areas. I think we need some commitments from the government. We need strong commitments from the public sector and development partners and donors or funders to these initiatives. I won't read through this slide. I'm sure it'll be sent later on. But ultimately, it's an overall call to action, because it's an opportunity for us to build on the great work that is happening. There's a lot of success in food fortification, reaching a lot of people and addressing some key micronutrient deficiencies, but more can be done. And the N4G Summit upcoming is a call to action for stakeholders from wherever we are sitting to commit to some tangible policy, financing, and market-based interventions that make fortification ultimately viable and attractive and impactful. And commitment is not a one-way street. If we all commit to do that, we just ultimately creating the right conditions for food processors that have to take the action of fortifying foods, make it more attractive for them to do that. And I think if we do that, we'll make a lot of success in getting micronutrients on the plates of consumers and down their stomachs. And we know that if we can do that, we don't have to prove the effectiveness of ingesting nutrients and consuming it. That's been proven over decades that is impactful. And so with that, I would like to thank you again, Saskia and your team for allowing us to come in.
Thank you so much, Riz, for illustrating the opportunities and the needs of the private sector in further advancing the success of large-scale food fortification. The next speaker in this section is Leo Schulten-Venboer, who is project manager at the Cane Premix facility. Over to you, Leo.
Yeah, thank you for the introduction, Saskia. Hello, everybody. I'd like to speak about the matter of premix quality and premix accessibility today. So what are the challenges that we're facing with regard to premix, and what are commitments that can be made to improve the situation? But let me start with introducing the work that we're doing with the Cane Premix facility. Next slide, please. So the Cane Premix facility has been set up to improve access to affordable micronutrient premixes and to certify the quality of the producers that are present in the market. We do that by auditing producers and publishing a list of approved suppliers for micronutrient premixes, as well as for approved suppliers of potassium iodate and fortified rice kernels. In order to be listed with the Cane Premix facility, producers need to present a food safety certificate, as well as information on homogeneity and shelf life of their products. Afterwards, they'll be audited by us, and these audits are to be repeated every 1 to 3 years, dependent on the quality level of the producer. If they pass, they become part of our online list of approved suppliers. Currently, we have 44 suppliers with 61 production sites around the globe. The list is available online, and the link will also be posted in the chat. Every premix producer is welcome to reach out to us regarding an approval. We would very much welcome to add more premix suppliers also from low and middle income countries. So we already have a lot of producers from India on our list. We also recently added producers in Pakistan and also in Uzbekistan. Next slide, please. But so now, why is it important to check the quality of the premix suppliers and of their products? In the manifesto on accelerated action for large-scale food fortification, the first recommendation to guide stakeholder commitments is to improve compliance. The manifesto calls for commitments to work towards 90% of compliance of the fortified food and to work towards 100% use of adequate premixes. So premix quality is essential for achieving the compliance. A flour mill or an oil mill can do everything right in production. They can handle the premix correctly. They can dose it at the correct rate. But if the premix that they're using does not meet the requirements, they might still end up with a non-compliant product. So what can be done to improve the premix quality in the markets? First of all, governments can introduce a list of approved suppliers for their countries. And this list should also include quality criteria. The GAIN list can be used for that, or own quality approvals can be conducted. Then there should also be monitoring of the premixes that are present in the market. And for that, the analysis of the premixes should always look at all components that are present in the premix. Also, a premix standard should be introduced to facilitate the monitoring. So what can the fortifying companies do? Of course, they should ensure to purchase premix only from approved sources, and they can either refer to the GAIN list or to their country list, given it also includes some quality criteria. Then they should also regularly check the fortification levels of their product. Then premix suppliers, of course, should provide premix that is suitable for achieving the adequate fortification. But this is also a question of putting quality in the focus, for example, by ensuring the individual ingredients that are used in premix are of adequate quality. It also means giving advice to their customers with regard to the technical aspects of the product. So that would usually be during the development stage of developing the premix for that end product. Also, the premix suppliers should really take responsibility for the fortification of the end product and commit to being available for any kind of questions, really tailor the product to the needs of their customer and train their customers on the correct use of the product. So it can be, for example, regarding the storage and regarding the product handling of the premix. This can also be done with partnerships. And Riz just gave a great example of the Millers for Nutrition partnerships, in which premix companies also give business-to-business technical assistance. Next slide, please. The second area related to premixes is accessibility and affordability. So staple food producers bear the main share of the cost of fortifying their products, and fortifying means considerable effort with regard to procurement, production, and quality control. Governments and premix suppliers can support them in that. For example, governments can reduce the cost of premix significantly by eliminating the import duties on the premix. They can also facilitate the procurement by prioritizing the allocation of forex for buying the premix. This will also boost the motivation to fortify, as it shows that the miller's contribution to the public health is acknowledged by the government. Also, premix producers can contribute. They can commit to reducing costs and effort by working in partnership, again, with their customers. So that will mean providing technical support, for example, also to smaller customers, and not only to the big companies in the market. And when it comes to the pricing, the public health impact should also be considered. Supplying premix must always remain a business, must make business sense for the suppliers, but the public health impact should always be taken into consideration, also as part of the corporate social responsibility of the premix companies. Thank you.
Thank you very much, Leo, for illustrating the advantages that a premix facility can have for countries that want to step up and scale up large-scale food fortification. The final speaker in this section is Budianto Wijaya, who is the President Director of PT Bungkasari Flour Mills in Indonesia. Over to you.
Thank you, Saskia, and greetings from Indonesia. I'm in Medan now, in North Sumatra, in one of our factories. So I'm currently in the board of the Bungkasari Flour Mills Indonesia, but I'm also on board of the Koalisi Fortifikasi Indonesia, and also help raise with the Millers for Nutrition. Okay, next slides, please. Okay, a little bit story about our mills here. So we are one of the most modern flour mills in the country. We produce we process around 1 million tons of wheat annually. We have 3 factories in Java, Sumatra, and actually in Celebes Island. It's a joint venture from 3 shareholders, actually, from Malaysia, Indonesia, and Japan. And since our operations in 2014, we've been fortifying all the wheat flour we produce, as actually mandated by the regulation. So, okay, just a brief background about the company. Next slide, please. Okay, so maybe we look at the landscape of the large-scale food fortification in wheat flour. The map on the right is the Indonesian archipelago. So as you can see here, the orange ones are where the mills are located, mostly in Java Island, as it's the most populated islands. So we have also mills in Sulawesi, in Celebes, and also in Sumatra. And the graphs on the left is actually showing the calorie source per capita as being surveyed by the Indonesian National Food Agency. So as can be seen here, actually, wheat has become the #1 source of calories, actually, among the populations outside rice. We are still a rice-eating country. And then if you look at the history of fortification, it's actually coming from, it's one of the effect of what we call as the Asian monetary crisis in 1998. Wheat flour has been fortified since 2000, and as actually one of the program from the UNICEF, but then it becomes regulated or adopted by the governments. And the wheat flour has been fortified with the Fa, zinc, vitamin B1, B2, and folic acid since then. And then based on the the orange book that the WHO actually published a while ago. Effective in 2021, we need to change actually the type of iron because initially it was not specified. So everybody's just use the lowest price iron, which is elemental. And it's found out that it's actually not so available biologically, as we may know, because the wheat flour, mainly because the wheat flour consumption is still quite low at around 24 to 25 kilogram per capita. And so by these new guidelines, actually we can only use more bioavailable ones like NIFA, EDTA, ferrous fumarate, or ferrous sulfate, which are allowed to be used in the flour fortifications. Wheat flour, I think this is a very common question coming from many people, why wheat flour is fortified as a vehicle for fortification. The reason is because it is widely used and its consumption is still increasing actually. The graph shows number 2, but then still continue to grow, and probably the rise consumption as population becomes more affluent, it tends to be lowering down a little bit. And one advantage is actually the modern mills in Indonesia. They are modern and they're quite limited the number. Like we only have, based on the data, around 29 mills in the country. So the limited numbers of producers will make the monitoring quite easy for the government. Okay, we go to my last slide actually. Okay, besides the very wide adoptions of the flour fortification, we actually still have some challenges. Flour industry complies with the wheat fortification standard because actually we have to say it is mandatory. Actually, it's a mandatory fortification, and actually it brings us a quite positive image to the industry. The other thing is the impact of the wheat flour fortification is yet to be demonstrated, and the industry actually spends around 14 million USD per year on the premix cost and the fortification cost. And the other issue is the use of ferrous fumarate to replace elemental iron. Actually, it's been quite challenging to some end users, quite limited. That is a particular type of product such as boiled wet noodle may show unwanted black spots. And so we in the industry actually work closely with the fortification suppliers to solve this problem, as we actually notice that certain supplier is better than the other in preventing these kind of issues. And then last point is actually accessible with flour, salt, and palm oils mandatorily fortified with iodine and vitamin A in Indonesia. I think that's a very brief slides from me. Thank you very much, Saskia.
Yes, thank you so much, Mr. Wijaya, for your insightful presentation in how you, with your company, is contributing to the success of large-scale food fortification in Indonesia. We've heard now from all the speakers about both the progress that's been made in large-scale food fortification in Asia, as well as challenges that remain and that need really further investments to reach the full potential of this intervention. And the Nutrition for Growth Summit is an important opportunity for commitments that address these challenges. We will hear in our last section of today's webinar from 2 speakers of how stakeholders can have access to resources and tools that are available to develop smart commitments in the area of large-scale food fortification. Our first speaker in this section is Dr. Ludi Omolo, who is the Senior Associate of Global Advocacy of Large-Scale Food Fortification at the Global Alliance for Improved Nutrition, GAIN. And the second speaker is also from GAIN, is Kristen Sandel, who's a Senior Advocacy Specialist in Large-Scale Food Fortification at GAIN. Over to you, Kristen and Ludi.
Thank you very much for the introduction, Saskia. And I think I'm pleased to join with my colleague Christine to share some of these resources. We can go to the next slide kindly. Thank you. In 2021, during the N4G Tokyo Summit, there was inclusion of nutrition commitments that really led to billions of dollars in financing. However, we note that these commitments were pretty broad. And of course, we also see N4G as a powerful tool to advance fortification at the national, regional, and global level. So we really want to make sure that all of us have access to tools that can help build strong fortification-specific commitments. So first, we'd like to point you to two key advocacy resources that will help you with your commitments. And the first is a fortification-specific guide for N4G that was really developed by the Global Fortification Technical Advisory Group. On your screen, that's what's on the left. And this tool really guides policymakers, businesses, donor groups, civil society groups, N4G country coordinators, and of course, other supporters of micronutrient nutrition. In that guide, you'll be able to find background on N4G Paris and fortification, instructions on how to make commitments areas, and of course, the focus for N4G fortification commitments, what stakeholders need to do, and of course, examples of smart resources. The guide is intended to complement the second resource on the screen that's on your right, which is the broader N4G Paris engagement on a commitment guide. So on the left is LSFF focused, on the right is the general nutrition focused. Next slide, kindly. Thank you. I think we just want to focus a little on how to build smart N4G commitments. And we are going to do this with an example on how governments are able to really make smart LSFF commitments. And so, as you can see, the commitment is quite specific. And I think that is the intention and what we are really trying to advocate for, that we have very specific. And one of the features is there that it's mentioned that we need to know how, when, what kind of progress, how it is going to be reported, and of course, during the time frame for that kind of indicator being achieved. So in that one example, and of course, this can also be, you can also have some for businesses, for donors, and of course, other supporters. It can be programmatic based, it can be policy based, financial, just to support progress toward national and regional nutritional goals. And of course, this really helps strengthen and build upon existing fortification programs and policies, so that these policies can reach more people with higher quality fortified staples and foods. Again, there's need to revise and update the existing policies and to bring them in line with the current data, because I know data changes and data should influence policy. A link of this is in the chat. And of course, I hope all of us will be able to use it to build smart commitments. We also recommend that as you build commitments prior to the Paris N4G Summit, let's build on what was done during the N4G Tokyo commitments. And this should align, of course, with our national nutrition plans, and to integrate nutrition within the sectoral plans and investment. I also did mention that it is important to monitor progress and report to that. And of course, to do this, then these commitments that we make should be budgeted for and financed adequately to ensure that the accountability, and of course, to ensure the accountability processes are explained to duty bearers. Also, we urge that we register our commitments in the publicly available Nutrition Accountability Framework platform and report progress annually in one way of helping hold accountability. And it's of course required that you do this when you commit, and your commitment is included in the N4G. Next slide, kindly. Thank you. As we know, we've previously just seen the language that we are supposed to craft for this. And so as we prepare to make these commitments, we have got some key dates and timelines to really follow in terms of having the commitments and making the commitments. So the first thing really before you even proceed with making the commitments, kindly engage the N4G focal points at the country level. And for those countries that are part of the scaling up nutrition movement, then the N4G focal point is often also the SAN government focal point. So kindly visit SAN's website to see a list of SAN countries. If you are unsure, or if your country is not part of the SAN movement, then kindly contact the Paris N4G mailbox that has already been shared on the mailbox on the chat. Now, what are the timelines for making these commitments? First is that for the commitments to register in the Nutrition Accountability Framework, then we need to have this before February 28th, which is in a week's time, so that they're really able to be verified in time for the summit. Now, if we are not able to do that by the 28th of February, then any commitment that will be registered by the March 28th, which is at the end of the summit, these will be considered for inclusion in the N4G Paris Compact Annex, which is a publication that will summarize and list the commitments stakeholders make. Kindly also check out the previous Compact Annex for Tokyo just for further guidance on how that is captured. Now, if you need a little bit more time, then we still have the possibility to register the nutrition in the Nutrition Accountability Framework after the summit until end of June 2025. And this, of course, will be counted towards the N4G Paris. For now, as we head to the next slide, I'll turn it over to Christine to connect the N4G commitments with the broader advocacy opportunities. Christine, over, as we head to the next slide.
Thank you, Ludi. So building on what Ludi has shared, I'd like to set nutrition for growth in a wider context of global and national advocacy for food fortification, and just share a few resources to support your advocacy for food fortification at Nutrition for Growth and beyond. So as Dr. de Regil mentioned in her keynote, 2 years ago, the World Health Assembly passed a resolution calling for accelerated efforts to prevent micronutrient deficiencies through large-scale food fortification. The World Health Assembly is the decision-making body of the World Health Organization, and it's composed of delegations from all 194 WHO member states, and it's responsible for setting WHO's policies and making key public health decisions. It typically meets in late May every year in Geneva. The WHO Food Fortification Resolution calls for progress reports every 2 years, beginning next year in 2026 and running through 2030, which means that food fortification will be on the agenda and member states will have the opportunity to share what they are doing to advance food fortification in their countries and regions. Next slide, please. N4G plays a critical role in translating the World Health Assembly resolution on food fortification into real-world impact by securing smart commitments, driving investment, and strengthening accountability. So this means more donor and government funding for large-scale food fortification programs. It potentially means more private sector investment in fortification, technology, and compliance. It means that national nutrition strategies are aligned with the WHO resolution's recommendations, and regulatory reforms and enforcement mechanisms are set that improve fortification coverage. The point here is that Nutrition for Growth commitments to food fortification have significance that goes beyond the member state or stakeholder making the commitment. They also are contributing to global and regional momentum to strengthening and scaling up food fortification, and ultimately to significantly reducing micronutrient deficiencies around the world. So by making and supporting N4G commitments, we are all part of this wider effort as well. So what I'd like to do now is just very quickly walk you through some of the resources available to support you in this work. Next slide, please. So the first resource I would share with you is the Large-Scale Food Fortification Advocacy Toolkit, which can be found at futurefortified.org. The toolkit has advocacy resources, including policy briefs that can be shared with decision makers, the Nutrition for Growth Food Fortification Commitment Guide that Ludi mentioned in his presentation, as well as a guide for communicating effectively on large-scale food fortification and other resources. The toolkit currently is focused on nutrition for growth and the World Health Assembly resolution as the primary opportunities for advocacy, but it will be continually updated with new resources and new advocacy opportunities. So this website is a place you can go return to over time for resources on an ongoing basis. Next slide, please. Next, we have the Future Fortified mailing list. This listserv, which you can subscribe to with the through the QR code that you see on the screen, and also through the link that was just dropped into the chat. The listserv will be part of a new communications initiative on food fortification that will be kicking off later this year. So in addition to sharing information about webinars and events like this one, this listserv will also be a resource to share the latest research and resources and learning from food fortification programs around the world. Next slide, please. Finally, I would point you to the Global Fortification Data Exchange, or GFDX. You can find it at fortificationdata.org. And GFDX is a really great source of detailed information on national food fortification programs and on the state of food fortification globally, including data visualizations that you can create and use in presentations and in your advocacy. GFDX collects its data through biannual surveys, and there is actually one opportunity I'd like to flag for the audience here is that survey is about to launch in the second quarter of 2025. And GFDX, the data contained at GFDX is collected from country level data that is shared by government agencies, by implementing partners, by UN agencies and donors, by academia, universities, and by industry. So it's by sharing this data through the GFDX survey that the GFDX can be kept current and be a really good high-level resource for fortification data. So I would encourage you all to consider contributing to this next survey that's about to begin, and you can reach out to the email that is in the chat for GFDX to contribute to the 2025 survey. So with that, I will thank you very much, and over to you, Saskia.
Thank you so much, Kristen and Ludi, for demonstrating and for presenting all the good resources that are available to assist those of you who want to work with your countries and with partners on commitments for nutrition for growth. So with this, we are almost at the end of the webinar, and we have a limited amount of time for questions and answers. But I've seen that in the Q&A chat, there has been a lively engagement and also a lot of questions that were already addressed in the Q&A chat. And I hope that you will continue, of course, these discussions beyond this webinar when we speed up our efforts for a very successful summit at Nutrition for Growth next month. There is, however, one question that I would like to highlight and to address in this section, and that is a question to Dr. Rashid in Bangladesh. In your partnership or in your alliance, you also mentioned that private sector partners are part of those. And one of the questions that was asked in the chat by Maria Tsvetkova is how did you do the selection of those private sector partners that are part of the coalition? So maybe Dr. Rashid, if you can put on your mic and your phone. Yes, please.
Okay, thank you so much. Actually, The question is very good one, and it's also tricky one. As you know, the public-private partnership there is an informal partnership is already there. So for the formal integration, we need to actually discussion at the government level in the different member states. And also there are several occasions are there for the integration of the private and public sector. So maybe some with the criteria with those on who has the multi-dimensional business, they can the priority, and they have the who have the earlier experiences for the branding quality, that can be considered for the selection of these private sectors. Thank you.
Thank you so much for addressing this. And my next question goes to Dr. Shabina Rasa, and actually is building on this question, because we've heard a lot about the importance of collaborating, and obviously in the space of large-scale food fortification, that may be even more important. And in some countries, we know that national fortification alliances are active. In some regions, in other parts of the world, there even are regional collaboration mechanisms to support large-scale food fortification efforts in the region. So with a view on Nutrition for Growth and the Nutrition for Growth Summit and commitments that are being made there, Dr. Shabina Rasa, for Pakistan and for the region, what do you think is most needed to encourage these type of collaborations and to make them also effective? Can you put on your mic and your camera, please, Dr. Rasa?
Yeah, thank you for that question, Saskia. Actually, in Pakistan, we started off with having a National Nutrition Alliance, Fortification Alliance, bringing all key stakeholders in the country together. And then we also had provincial alliances set up. They did work for a couple of years. We had them very active. However, over time, with change of governments, somehow those alliances became a little bit of redundant. So that is a bit of a sad story here in Pakistan. But we do realize that this is a very critical and a key intervention that countries should have within countries and within regions. So this is something which needs to be worked on, and the government's commitments need to be brought into this. This is an opportune moment that we raise this and we make sure. So we're working on it. Thank you for bringing this up.
Yes, thank you very much, Dr. Rasa. So if I understand you correctly, we really need sustained commitments in these types of collaborations that are not dependent on political changes in countries, which in itself is a challenge. But I do think we have an opportunity now coming up for these type of commitments. So thank you very much. So with this, we are at the end of the webinar. Obviously, this is not the end of our conversations, and I would like to encourage the participants and the speakers and the panelists to stay in touch. We've given you a lot of information in the chat on how to best do that. And I want to also highlight that the recordings of this webinar will be made available on the Micronutrient YouTube channel, so you can see all the presentations and hear all the presentations again. There will also be at the Nutrition for Growth Summit in Paris a side event on large-scale food fortification, which will be held on March 24th as part of the Civil Society Organizations Pavilion. And this side event will also be live streamed. And we will send you more information as soon as we have it, and so that you can access the live stream, or if you happen to be in Paris, attend the session. So today we've heard about large-scale food fortification, which is really a critical tool that countries have for sustainable food systems transformations. And we can make this work, and we can increase the reach of this important intervention by strengthening public-private collaboration more, because that's essential for large-scale food fortification success. We know that we have an important opportunity coming up and a momentum coming up at the Nutrition for Growth Summit in Paris to help driving these targets and help driving commitments that really address the barriers to large-scale food fortification, so that it really becomes available for all of those that need it most. And with this, I would like to really thank you for participating in today's webinar, And I look forward to your continued collaboration. And I don't want to leave this webinar with giving a big shout out to my colleagues behind the scene, Christina Michaud and Maureen Raudo, who have done an excellent job in bringing this webinar together. And thank you very much and have a very nice day.
Goodbye, everyone.
Goodbye. Thank you. Bye.
Thank you.
Goodbye.